You know, for hundreds of years, the center of the healthcare universe has always been the hospital, right? But that's changing. More and more services are transitioning off of the hospital campus, closer to where you live, making them easier for you to access. Hi, and welcome back to LifeWorks PRMC. I'm Roger Fallabout, the Director of Community Relations at Peninsula Regional Medical Center. It's population health. It's really a new concept that's catching on across the country. And here to talk more about population health at Peninsula Regional Medical Center is the Executive Director of Pop Health, Katherine Fiddler.
Hey, Roger.
Hey, Katherine, how are you?
Great.
Great to have you on the program. As we always do here on LifeWorks PRMC, we offer our guests the opportunity to tell us a little bit about themselves. So for the first couple of minutes of the show, give us the Katherine story.
Great. I am not an Eastern Shore native. I think that you have to get that off your chest right away.
You're a come here,
I'm a come here,
just like me.
And I've stayed here for more than half my life and absolutely love it. I'm a third-generation nurse. My mother and grandmother both told me not to be a nurse, and I joined the military and went on a path of not being a nurse and just had to come back and got my nursing degree at Salisbury, got my master's and my doctorate at Salisbury, so I'm a 3-time winner from Salisbury University. And now, having come from 5 years working for an insurance company, working for Care First over in Baltimore, I wanted to come back and really have an opportunity to make a difference here on the shore with the community that I serve.
Yeah, this is kind of a homecoming for you at PRMC too, because your nursing career began with us, right?
It did. I was an ER nurse, 12-hour shifts, raising a family. The beauty of nursing is there's a lot of convenience to scheduling. You can pick a job that's part-time or full-time while still gaining that skill, and I loved it. But that's really, Roger, where I started understanding how broken our healthcare system was. I'm in the ER, folks would come in, and then I couldn't help them once they got out. They'd come in again, and so much was broken, and I didn't have a lot of opportunity to impact it. So that's been that awareness that I had, and how I wanted to get back to being able to connect all those dots.
All right, so population health. I mean, look, haven't we always been taking care of the population anyhow? What does all this mean?
I think it's the awareness that the hospital is not the epicenter, that we aren't the center of the universe. It's really, I think it's better to say community health. How do we care for our community? And looking at what do we need. We know we have an aging population here on the shore. We know we have a population that's challenged with transportation. We know we have a very diverse cultural population. So how do we really tailor and design community services to fit those people and do it much better, improving the outcomes outside the walls before people really fail, break down, and have to come into the hospital?
I mentioned at the beginning of the show that, you know, a hospital has always been the center of the universe, if you will. Build it and they will come. We build the hospital, you come to us, we render the services there. But we're really getting more and more away from that. And I think that's important. And I think that you would tend to agree that getting out and bringing those services directly to the people is key to getting them to participate in those services.
It is, and I don't want to discount the hospital. Phenomenal, phenomenal resource, so needed, everything that happens every day in the hospital.
Right. But
there's so much that can be done outside the walls. You can do education in churches, in community centers. You can do one-on-one education. We have a team of community health workers who actually go out. These are not nurses, but they're licensed nurses aides who can go out and help a patient understand, what does it mean, what does a nutrition label mean? How do I talk to my doctor? What kind of questions would I ask? And really sit one-on-one and have a relationship, and then help people navigate this challenging healthcare system.
So how do you build this? I mean, for so long we've done healthcare one way. Now, all of a sudden, we've turned this whole thing upside down. And as you said, we'll never get away from doing the surgeries. We'll never get away from the emergency department visits. We'll never get away from the joint replacements and the neurosurgeries that we do at the hospital. But we've really kind of taken this whole model and flipped it over. So how do you build this? How do you design this? And how do you get people interested in participating in this?
That's the million-dollar question. I think we have a luxury here on the shore that other folks don't have. We have a large tertiary center that does great work. And we're the only one. We're not competing with a Mercy and a Hopkins all right on top of each other. So we have a community that cares about itself. But what we don't know is how to use all the resources around us. So our job, as we think about what's going on outside the hospital, is thinking about what other resources are there. We have the MAC organization. They do a phenomenal job with education on chronic disease. They have fall risk prevention programs, depression programs. We've got the Y, who does a lot with wellness and community, and the United Way with working on how can we help use health literacy as a tool. So I think our job as a hospital hospital, and as a big employer in the area, is connecting the dots and figuring out what else needs to be done. You need a lot of analytics. We have the opportunity, we're going to be undergoing the Epic conversion in about a month. And so analytics provide you the who do we need to help sort of information and understanding the populations. But it's day by day, it's committed people. We have a phenomenally committed community to changing the way healthcare is delivered. So I think, first of all, it starts with building relationships and then putting all those pieces in place.
Yeah, you talked about partnerships. And I really believe that population health doesn't exist without those partnerships. So how do you build those? I mean, what are you looking for when you go out into the community and say, you know what, it really is going to take a village to make this whole concept work and to keep people healthy and well versus coming back to the hospital on a regular basis. So how do you go out and sell that in the community to these partners that you want to work with?
I think the partners are there and they want to work. I think we've always been here, but we've never stepped outside our comfort zone.
Yeah.
And I think it's showing up. One of the interesting things for me, I drove to MAC the first month that I started in this role, and just drove over there to see what they had because I had heard they have these classes. I had a preconceived idea what it was. I was amazed. They gave me a wonderful tour. I listened in on some of the classes. I've seen their gym. So that awareness of what really is out there, there's so many things going on in the community in individual silos, just as in healthcare, individual silos, that it's really about building relationships. You go out, you visit them. We have community meetings with our local health departments. We have meetings with MAC. MAC, in fact, came to the hospital today to do a presentation to our senior leadership and talk about what are the offerings that they have and help us to collaboratively build something even bigger together. Because we don't want to do the things that are being well done in the community. We just want to connect the dots.
Yeah, I'm surprised sometimes to find out how much when we are working in silos, when we really think that we aren't, but when you get out there and find out, you know what? We really are. You've heard Chris Hall, our VP of Strategy and Business Development, talking about transforming that big blue and white H sign that stood for hospitals forever. What are some of the keys in the transformation? What are some of the things that you're trying to do, at least initially, when you're building these programs?
I think one of the first things we've done as an organization, we're building the Peninsula Regional Clinically Integrated Network. What that is us, the hospital, our outside our Peninsula Regional Medical Group, so our family practice, and then partnering through this clinically integrated network with other primary care providers in the community. We have Dr. Davis's office, Dr. Nateson's office, Dr. Huddleston's office, 3 lower counties, Dr. Patchwitz's office, and all of these providers and their staff come together at different times to talk about how can we all do this better, this true continuum of care. So building those relationships in a very different way, saying our problem is we have a problem with heart failure. How can we all do the right thing for the patient throughout the continuum? We have a transitional care team that helps connect those dots as well. So when patients are in the hospital and they're perhaps a high-risk patient, have a challenging discharge, they might not know what services to get, those nurses will then follow them out there. So they're helping to connect those dots. So I think starting with those pieces, building a team that talks to each other, is probably the first step, and it's what we're starting to do fairly well, and then building it from there, getting more tentacles out in the community.
One of those partnerships that I know about, and I'd like you to touch on a little bit, is something called CareRap that we have with the Lower Shore Clinic. One of those community partners that provide the service and a great partnership for the hospital as well. What does CareRap do?
So CareRap is a phenomenal program. We just started it. It went live in May of 2016. And what it does is, we do identify patients that are very challenged with getting resources. Oftentimes patients have multiple comorbid conditions. They might have a behavioral health concern as well. And so what we can do is, through the CareRap program, we assign them a nurse who meets them in the hospital before their discharged, develops a relationship with them. And then she has 2 community health workers. Both of them have vehicles. They can get patients to appointments, take them to the grocery store if they needed to get some food, get them set up with services, and really hold them very closely, develop a wonderful relationship, usually for about 3 to 6 months, to empower them and enable them to be able to do their health care on their own. It's a wonderful program.
As consumers of health care, all of us, we also have skin in this game, if you will. So what do we need to do to be good population health consumers of those healthcare services?
I think the first step is really finding a provider that you trust, that you're willing to go to and see, because we all have preventive care benefits that are free. Or if you have health insurance, that preventive visit every year, all those services are free. Go to that provider, talk to them, ask questions, and don't be afraid to reach out to us, to the hospital, to other folks in healthcare and say, how can I do this better? What questions do you have? It's just such an important thing to ask lots of questions and not assume the status quo. We have a lot of resources at the hospital. Call us. We're here. I know you can connect on our website. But just ask the question of, what else can I do? What do you think about this? If you don't ask questions, the doctors won't know that you don't understand the plan.
Absolutely right. You know, we had Dr. Edney on the program recently, and Dr. Edney is spearheading this health literacy program here in our community. How important is that in population health as well, for you not to only go out and form these partnerships and reach out to people in the community, but also to educate the community about staying healthy and what they're doing?
You know, I think health literacy is it's a big word. It sounds kind of confusing. I can read, what does health literacy mean? But each one of us, I only know what I know. I don't know anything about cancer. So I am not literate on cancer. I think it's important that we're okay with that and saying, can you explain that again? Explain it a different way. Mm-hmm. But it goes back to, you've got to just ask some questions, say, I don't understand, and be okay with that, because we all assume if people don't ask questions that you must understand that plan. I can tell you when my dad had bypass surgery, he had gone in for a heart catheterization. I knew what that was, and I was a nurse at the time, and I knew that he was going to come out with a pacemaker, and that was the plan. And when the doctor came out, he said my dad needed bypass surgery, and I didn't hear another word he said. I'm a nurse. This is what I do for a profession. I didn't know the plan. I didn't know when it was going to be done. My mom was with me. Neither of us knew anything. And the doctor talked to us for about 10 minutes. He did a wonderful job, I'm certain, but I was already in a different place and not ready to listen. So I think we forget sometimes as healthcare providers that even if it's us, it's hard and it's challenging to hear everything when there's so much going on. And it's you and you're worried.
As you mentioned, you became almost instantly then your dad's advocate for what was going on with his healthcare. How important, and we hear this a lot, and as a nurse you know this, families are huge advocates in the care of their loved ones. How important in population health, or is it equally as important in population health, to have a family and to have loved ones involved in helping you through the process?
Well, we know all the research shows that if you have family to help support you through challenging times, that you do come out better. But it's not always family. Sometimes it's just a neighbor that you really have a good connection to. Sometimes it may be a caregiver. But whatever that is, it's important to have that person and to tell them what you want, to tell them what your life plans are. Say, this is what I would want if something bad happened. This is what I would want in case of emergency. Because I don't think we have those conversations. They make us a little uncomfortable. Yeah. But it's critical. It's critical to that success in each patient getting the patient-centered plan that they want. What I want and what you want are probably different things on any given day. So it's important that I let you know, if you are my healthcare provider, if you are my family member, what it is that I really want.
Last question as we wrap up the program, Katherine. 10 to 20 years down the road, where do you see population health in this big patchwork quilt of healthcare? How big a role will it serve? How big a patch in that quilt will it have?
I hope in 10 or 20 years we're not having this conversation, because it's not a patchwork quilt, that we really have a well-oiled machine of people understanding from the moment that they start school, that kids are educated on what healthcare, how important just health and wellness is, and we no longer have to talk about the diseases and things like that. That's where I see us in 10 to 20 years if we can continue to have these conversations.
Katherine, thanks for being on the show.
Thanks so much.
Great to learn more about population health, and best of luck to all of you at PRMC and taking on this big challenge. And that'll do it for this edition of LifeWorks PRMC. If you'd like to learn more about population health, as Katherine mentioned, you can hit us up on the website at www.peninsula.org. That'll get you to Peninsula Regional's website. You can learn more there, or you can contact me at roger.fallabout@peninsula.org, 410-543-7142, the old-fashioned way over the phone. We'll get you information on population health. Also, if you have ideas for this show, LifeWorks PRMC, love to hear from you as well. So that'll do it for this edition. Again, my thanks to Katherine, my thanks to everybody here at PAC 14 for making this possible. And until we see you on the next edition of LifeWorks PRMC, take care of yourself and those you love. Bye.